All right, today we're going to dive into a brilliantly simple diagnostic tool called the Photostress Recovery Test. Seriously, it's just a flash of light that can tell us a surprising amount about the health of your eyes.
You know that feeling, right? You're driving at night, some car with its high beams on blasts past, and for a few seconds, your vision is just gone. You're seeing spots, and it takes a moment for your eyes to catch up. It happens to all of us.
But imagine if that recovery didn't just take a second or two. For people with certain conditions like macular degeneration, that temporary blindness from a bright light can stretch on for minutes. You can see how that would make something like driving incredibly dangerous. And this poses a really critical question for doctors. So, when a patient comes in complaining about taking forever to recover from glare, the doctor has a bit of a puzzle on their hands. They've got to figure out why it's happening. Is the problem located in the eye itself, or is it somewhere further down the line? And this is where our hero of the day comes in, the Photostress Test. It's a simple, elegant technique designed to answer one very specific question. Is the problem with the retina, or is the problem with the optic nerve? I love this analogy because it makes it so clear. Think of your eye like a camera. The macula, which is part of your retina, is like the film that actually captures the picture. The optic nerve, well, that's the cable that sends the picture from the camera to your brain so you can see it. So this test helps figure out, do we have bad film or is it a faulty cable? And you know what the best part is? Figuring this all out doesn't need some huge, fancy, expensive machine. Nope. The whole thing is built around a test that is as quick as it is clever. That's literally it. The equipment couldn't be more basic. We are talking a bright pen light, a standard eye chart that you see in any doctor's office, and a stopwatch. You've probably got one on your phone. It's just a beautiful, simple solution. So here's how it actually goes down. First, the doctor checks your vision in one eye to get a starting point. Then they'll shine a bright light right into that eye for about 10 seconds. Now this is intentional. It's meant to bleach the light-sensitive pigments in your retina. The second that light is pulled away, the stopwatch starts, and they just time how long it takes until you can read the eye chart again. Okay, so the crucial part is what happens next. The entire diagnosis, the whole answer to the puzzle, comes down to that number on the stopwatch. So let's break down what those seconds really tell us. What is the doctor actually looking for here? How can a simple time measurement tell the difference between a problem with the film and a problem with the cable? Well, for an eye with a perfectly healthy macula, those bleached out pigments recover pretty fast. Your vision should snap back to normal, or at least close to it, in about 50 to 60 seconds. So under a minute is our healthy baseline. But, and here's the giveaway, if the macula, our film, is damaged, it really struggles to regenerate those pigments. So the recovery time shoots way up. We're talking more than 90 seconds, and sometimes it can even take 3 minutes or more. That is a huge red flag for macular disease. And this is the truly brilliant part. If the problem is with the optic nerve, the cable, this test doesn't phase it at all. See, the bleaching and recovery of the pigments, that all happens on the retina, which is working just fine. So the recovery time will be totally normal, right around that 50 to 60 second mark. Just like that, the test has basically ruled out the macula as the culprit. And this table just lays it all out perfectly. You've got a healthy eye or an eye with optic nerve disease, the recovery time is normal. But if there's macular disease, boom, you see that huge delay. It gives a super clear yes or no answer to the question, is the macula the problem? So let's kind of wrap this all up. Why is a test this simple, this low tech, so important in the world of modern medicine? Well, it all comes down to the power of simplicity. It's fast, you can do it right there in the office, it gives a clear answer to a very specific question, and it doesn't need any expensive, complicated machines. It just helps doctors solve that diagnostic puzzle and gets patients on the right track, way faster. And get this, what's so fascinating is how robust the test is. The recovery time isn't affected by things like how big your pupil is, or whether or not you wear glasses, or even how good your vision was to start with. It is laser focused on one thing, the function of those macular pigments. It's just a beautiful reminder that sometimes the smartest solutions aren't the most complicated ones. Who knew that a simple flash of light and a stopwatch could be all it takes to see the difference between a problem with the film and a problem with the cable that connects us to the world? Pretty incredible.